Are you committing one of the 7 deadly sins of psychotherapy? If you're a therapist, counselor, or mental health professional, listen up, because in this series we're diving deep into the biggest mistakes of psychotherapy and how to fix them. Welcome to the 7 deadly sins of psychotherapy. In this series, we're discussing the modern mistakes of professional mental health with the hope that together we can identify better practices and improve the outcomes and reputation of the psychotherapy discipline. The 5th deadly sin of psychotherapy has led to the neglect and outright contempt for the largest at-risk population of humans today, condemning thousands to deaths of despair. The 5th deadly sin is maligning masculinity. Gender bias is something society has been grappling with in the modern age, and we've begun addressing issues of equality, privilege, and disadvantage with science, reason, and empathy. And while the efforts to reveal our cognitive blind spots are good, not all methods are helpful. A new perspective, referred to as the deficit model, argues that masculinity itself is a toxic and mentally dysfunctional trait, and that all men have deficits or fundamental errors in their ways of thinking and living which require correction or condemnation. And over the decades, this view has unsurprisingly led to therapists being uninterested in meeting boys and men where they're at, and less equipped to help them. With the onset of this cultural blindness, male mental health has been devastated. Today, according to the CDC, 70% of all drug overdoses are men. 72% of all alcohol-related deaths are men. And perhaps the most shocking number of all, 80% of all suicides are men. Now, if those numbers applied to any other demographic of people, the mental health profession would be convening international symposiums to retrain therapists and target that at-risk population. But because of the deficit view of masculinity, most therapists merely shrug, blaming the victims of these issues rather than the healers who have failed them. Boys will be boys, says modern psychology with a sigh, as it buries a generation of men, but refuses to become competent in evidence-based male support. So why are we not very good at treating men today? Well, one major barrier is the lack of professional representation. Science has proven that patients are more likely to seek help when providers look like them and understand their personal experiences. When men are ready to see a therapist, they find that only a small fraction of the profession is male, which can discourage many men from getting help. Today, 3/4 of all therapists are women, and therefore 2/3 of all therapy patients are women. Another barrier is the lack of cultural training. A generation of therapists have been trained to see masculinity as a mental illness to be cured rather than a human experience to be understood. Most therapists have had no formal training in effective therapeutic approaches for men, resulting in even excellent therapists making avoidable mistakes. Stereotypes, media portrayals, and unseen cognitive bias can disrupt the power of the therapeutic relationship, causing male patients to feel misunderstood and unsafe, resulting in many boys and men disliking therapy generally and distrusting the profession as a whole. A third barrier is antagonistic attitudes. As society has sought to embrace the values of equality, there's often been an impulse to vilify those historically seen as powerful or privileged. This perspective has found its way into therapist education, causing many clinicians to confuse the importance of diversity, equity, and inclusion with unethical animosities and resentments. Therapists may tend to minimize male stress, believing that men suffer from a lack of shame for the privileges society gave them, even when statistically men are killing themselves in despair. These perspectives are not only ineffective, but inhumane and unethical. Yet they have become a significant presence in all therapeutic disciplines. Lastly, many mental health professionals have been complicit in dehumanizing men on social media. For want of attention, mental health influencers often label any expression of manhood as toxic masculinity, causing even healthy male voices which advocate for balance and self-care to be castigated for speaking to male-only audiences. Mental health terminology is often weaponized online to describe male characteristics. Confident men are psychopaths, ex-boyfriends are narcissists, men who argue are gaslighting, quiet men are autistic, rambunctious boys have ADHD, and male anger in any form is abusive. With so much psychobabble on social media describing men, can anybody really blame them for not trusting mental health care overall? So, how can mental health professionals improve their ability to help boys and men? Here are 5 research-backed ways therapists can improve their work with men. First, have an accurate view of male social expectations and pressures. 2, use structured, clear, goal-oriented interventions. 3, utilize strength-based approaches to establish a strong therapeutic rapport. 4, adapt verbal and nonverbal language and communication styles to better suit male patients. And 5, address your own cognitive biases, prejudices, and fears surrounding men. Throughout this series, we'll continue to explore the 7 deadly sins of psychotherapy so we can improve this vital profession for our patients and communities. I hope you'll join me with a curious and open mind, and that this series will challenge you to discuss with your colleagues how we can all improve. I'm Dr. Jim, the Sin City Shrink. Thanks for watching, and I hope to continue our conversation.